The US president is being treated with several types of medication. He first received an experimental cocktail of antibodies. So these are monoclonal antibodies. They're lab-grown molecules that are engineered to act as antibodies, and they prevent the virus from binding with human cells or entering human cells. It was created by a company called Regeneron, and they've just ended their first phase of their clinical trial. And the first results are actually pretty positive, but it shows that it's only effective in the very first stages of the disease when patients haven't developed antibodies yet. After that, Trump's team announced that he was put on a course of remdesivir, which is, an antiviral drug that stops the virus from replicating, and that's usually prescribed to patients who are already in the hospital suffering of a severe case of COVID-19 and in need of oxygen. And then on Saturday, his doctors over at the Walter Reed Medical Center said that he had been prescribed a steroid called dexamethasone, which reduces inflammation both in the lungs and also in other vital organs. Now, of course, this therapeutical choice has created a lot of stir because every one of these three treatments is supposed to be prescribed at different stages of the disease. So this has fueled confusion about Trump's health when he actually entered the hospital. So was this an abundance of caution because it's the US president, or were his symptoms a little bit more severe than what his doctors are now saying?